Uh, then there's a series of injections that are made from your own body. These are called cell-based therapies. And the reason why they're called cell-based therapies is because they come from your own cells. And so your body has an inherent ability to go out and heal itself. And these cells are there, but they're kind of misplaced. And so we go ahead and put them in the right spots. So the first one is a thing called platelet-rich plasma. And as it sounds like, this is made from platelets. Platelets are found in your blood, and anytime you have a cut and you have a scab, that scab is mainly platelets. And your mom has maybe told you at some point, don't pick that scab, and she was absolutely right, because that scab gets that skin to heal, it prevents infection, it reduces inflammation, and it has all these great growth factors in it that promote healing. Well, your joint wants these things, but it can't get them because you don't have platelets in your knee. And the only way you could really get platelets in your knee is if you had a serious injury to your knee and you broke your bone there and it bled into your knee. But we can do that without breaking your knee. We can take this right from your own blood and concentrate it into a certain level with avoiding certain cells that can cause inflammation to your knee, and put that in your knee. And over time, you could feel some improvement to your knee. But about 80% of patients will get better with that, and usually just one injection may last you up to a year, and you may need to have that repeated. And then we can take those platelets, but now we can add something to them, and those are stem cells and also this thing called plasma proteins. Now those come from your bone marrow, and your bone marrow is a rich source of these plasma proteins, and these plasma proteins help with the healing process by doing a couple things. Some of them add something to your knee, and some of them block things to your knee. A lot of times with arthritis and as we age, there are certain chemicals that rise in our knee, and they cause continual pain and destruction. But this bone marrow, or the protein from that bone marrow, can help block that and restore it to normal levels so that your knee can function. And on top of that, there are stem cells in there. They're mesenchymal stem cells that are in the form of a progenitor cell, which is a little hardier type of stem cell that can be placed into your knee, and that can help with the reparative process. But I think that their role is going to be smaller compared to the plasma proteins. So how this works is that we would take bone marrow from you, separate out those cells into these different layers, and inject some of those layers into your knee in a concentrated form. And then over time, your knee corrects. So it corrects it in a couple ways. It corrects that biochemical imbalance into your knee. It provides those growth factors. It reduces the bad things in your knee. And then finally, after allowing all the reduction in the bad chemicals in your knee and the promotion of the good chemicals in your knee, then the third thing that can happen is that you can go ahead and get some growth to your knee. But I think that's minimal, and most patients don't have huge changes in the growth of their cartilage, but they have significant reduction in their pain. It does take some time. It takes about 3 to 4 months for most patients to notice an improvement, and we coach you along during that period. But the nice thing is that most patients, once they start getting better at 3 months, at 6 months they're better, at a year they continue to improve. So this is a stepwise improvement that we see. And you may ask, well, how long will that improvement continue? Which that is an excellent question. I'm glad you asked that question.